and welcome back. In our lecture number 5 of Kinesiology, we will study about what is joint congruency, what is a close back position and a loose back position, and what is their significance. Let's start. First of all, what is congruency? During a range of motion, there is a position where joint surfaces fits into each other or matches each other. There is only one congruent position and all the other positions are incongruent. For example, if the knee is in extended position, the patella can move in all directions, while in flexed knee, the patella cannot be moved. So, the flexed knee is a congruent position for the patellofemoral joint. Now, the closed back position. The congruent position is also known as the closed back position. This is the position of maximum contact, and the joint is tightly compressed in this position. Joint is difficult to distract in this position, and all the surrounding tissues and ligaments are tight. As the knee extension is the closed back position for the knee joint. Now, what is the significance of closed back position? The stability and integrity check tests are done in this position, and injury mostly occur at a joint in its closed back position. For example, as the knee's closed back position is extension. So, if a person get a blow on an extended knee from the lateral side, he will get an injury, and the swollen joint cannot be moved into a closed back position. Now, what is the loose back position? As we have studied earlier, all the other positions except the congruent one are the incongruent positions, and the position of maximum incongruency is loose back position, that is also known as resting position. The capsule and supporting ligaments are laxed. What is the significance of loose back position? It is the position for passive separation of joint, and joint mobilization techniques are applied in this position as the surrounding capsule and ligaments are laxed. The orthokinematic movements including roll, spin, and glide occur in this position. Because a joint play is not a voluntary movement, so it requires relaxed muscles that are present in loose back position. Here are the loose back positions and closed back position of few joints. For example, the vertebral joint has a loose back position in the midway between the flexion and extension, while in maximum extension, the vertebrae have closed back position. In the temporomandibular joint, when you open your jaw slightly, it is a loose back position, and mouth closed with teeth clenched or mouth maximally opened are the closed back position. In the sternoclavicular joint, arm resting by side is the loose back position, and the arm maximally elevated is the closed back position. In the acromioclavicular joint, the arm resting by side is a loose back position, while abduction of the arm at 90 degree is the closed back position. At the glenohumeral joint, 55 to 70 degree of abduction, 30 degree horizontal adduction and neutral rotation is the loose back position, and the maximum abduction with external rotation is the closed back position. In humeroulnar joint, 70 degree flexion and 10 degree supination is the loose back position, while the full extension with and supination is the closed back position. In humeroradial joint, full extension and supination is the loose back position, while the 90 degree flexion and supination is the closed back position. If you have noticed, a closed back position for a humeroulnar joint is a loose back position for a humeroradial joint. Proximal radioulnar joint has a loose back position with 70 degree of flexion and 35 degree of supination, while the closed back position at the 5 degree supination and full extension. Distal radioulnar joint is closed back at 5 degree of supination and loosely packed at 10 degree supination. Radio or ulnocarpal joint are loosely packed at neutral and slight ulnar deviation, while with full extension and radial deviation are closely packed. In hand midcarpal joint are loosely packed at neutral, slightly flexed and slightly ulnar deviation, while closely packed at full extension. Carpometacarpal joint are loosely packed at midway between flexion and extension, while closely packed at full opposition. Trapeziometacarpal joint are loosely packed midway between flexion and extension and midway between abduction and adduction, while closely packed at full opposition. Metacarpophalangeal joint. In the first metacarpophalangeal joint, slight flexion is the loose back position, while the full extension is the closed back position. Or in the second to fifth metacarpophalangeal joint, slight flexion with ulnar deviation is the loose back position, while the full flexion is the closed back position. In the interphalangeal joint, the proximal interphalangeal joint are loosely packed at 10 degree of flexion, while the distal interphalangeal joint are loosely packed at 30 degree of flexion, and the both are closed packed at full extension. Hip joint is loosely packed at 30 degree of flexion, 30 degree of abduction and slight external rotation, while they are closely packed at ligamentous level with full extension, abduction and internal rotation, at bony level with the 90 degree flexion, slight abduction and slight external rotation. Knee tibiofemoral joint is loosely packed at 25 degree of flexion, while closely packed at full extension and external rotation. Talocrural joint is loosely packed at 10 degree of inversion or eversion and 10 degree of plantar flexion and closely packed at full dorsiflexion. Subtalar joint is loosely packed in midway and 10 degree of plantar flexion and closely packed at full inversion. Mid-tarsal joint is loosely packed at 10 degree of plantar flexion while closely packed at full supination. Tarso-metatarsal joint is loosely packed midway between supination and pronation while closely packed at full supination. Toes, including metatarsophalangeal joint, are loosely packed at neutral position and closely packed at full extension, while the interphalangeal joint of toes are loosely packed at slight flexion and closely packed at full extension. The loosely packed positions are very important in mobilization and must be remembered by heart because these positions will be adapted to mobilize a joint in a patient. If you like my video, then give it a thumbs up, comment and share, and don't forget to press the bell icon. Thank you.